Thank you very much. I would like to mention two things. One, the Physicians for Social Responsibility and International Physicians for Prevention of Nuclear War Germany chapter is available on the PSR website, www.psr.org. Also, most unfortunately, representatives from UNSCEAR were not able to participate in this meeting. We did have discussions about having that take place, but they were not able to be here. So at this point, we have just about 20 minutes left. I would like to ask if any of the press that are in the room would care to ask any questions to the speakers. Sir? Here's a microphone.
This is just a question about the role of the ICRP. It's come up in both of the in all of the presentations actually, that they're setting standards, but the standards are adopted by governments. And I would like to understand better what role PSR can have in getting the public to understand that the ICRP standards are based, let me say, on studies that are of dispute. And we have in this country the NAS showing that there's no safe level of radiation. A number of studies have been shown that over the decades. Yet the ICRP is setting standards as though there is a safe level, and these reports seem to be driven by the fact that at core there's some safe level here. Am I right or wrong, or what can be done here?
The same scientists serve on the ICRP as serve IAEA, who serve UNSCEAR. They are sometimes the national members to those organizations, but they also are advisors and members to, and actually leaders within ICRP. So there is a kind of breakdown of independence among the organizations. And because there is, I don't want to call it a revolving door, but it's sort of like that, where there's a small pool of experts advises everyone and participates in everything. So it's not surprising that there are similar conclusions drawn. And the idea of safe limits is nonsense. I think that the scientific consensus is overwhelmingly that there is a linear relationship, no threshold for inducing disease of any sort, that any excess radiation, any increase of radiation is harmful, potentially. And in various systems that can be demonstrated. So it is in the interest of national policy around the world, and including in our country, the Environmental Protection Agency, who is specifically charged with setting safe limits after an accident or industrial contamination or for various cleanup sites. They're responsible for setting the standards for what's acceptable cleanup. And some of these standards are set into regulation, and the EPA is working very hard to eliminate those kinds of standards. Their point is that 1 millisievert, 20 millisieverts, 100 millisieverts, it's all nonsense. It's a linear thing, and we reserve the right to, at the time of an accident, or when a Superfund site needs cleaning up, at that time, we will determine from all factors consistent what is a reasonable cleanup standard. And that is the kind of rules that don't apply to the people setting up those rules. They won't be in their jobs when the time comes. The press and the people will say, but what is a safe landing? How did you determine that? And there'll be the same kind of blocking and lack of transparency. So we need the regulatory bodies, but we also need to have a public component and transparency to these conversations that doesn't exist.
Mr. Grover, did you want to?
I just want to. I just want to add a couple of points. See, this notion of safe limits. First of all, the basic argument that you will get from the international agency is there's background radiation. But the issue is background radiation safe? No, because the effects on the body by radiation is caused through mutations in the DNA. So that occurs at a particular level. Now, as you increase it, those mutations increase and they can be intergenerational. So the myth that is created is, well, you have background radiation anyway, so if you increase it a bit, what is the harm? Now, that actually is not correct. That's the first point. The second point is this, according to me, a very dangerous precedent which the ICRP is setting, that during what I call peacetime, when there's no disaster, you can have what is called the safe limit, which in Japan under a law, it's under a law in fact, and there are different safe limits for the general public and for zones which, like a radiation plant, where workers are working. So 1.3 millisieverts per quarter is for workers working. Okay, so then it is 20 millisieverts for certain areas per year, and 100 is the outer limit under the law which was extant in Japan at the particular time. How can you then increase after that? Where do you get the notion from? And there's no answer to that. Thirdly, there is a major problem, and I think this is where the communities who are interested on the right to health, the right to safe environment, etc., have to work on. The general consensus in all the UN systems, all international agencies, that upping the radiation limit is okay. Hunky-dory is the phrase that that I use. It's very common popular in America, but I think that's what they are saying. Now you have to demolish that myth, and that is not easy to demolish. How do we do it? Marie said issue statements. I think there is much more to be done. There's a need now to link up internationally amongst NGOs and communities. I always distinguish between NGOs and communities. Communities are directly affected. They are passionate about, their learning is experiential. They go through the pain. Like Mayor of Fukushima he's no longer the mayor, but he's all over the place just running around to expose people on this issue. Whereas an NGO like, say Lawyers Collective or Anand Grover, I have only an abstract understanding of that. But the merger of two is very important, because you need the knowledge, the actual abstract understanding of a situation, how radiation affects people and people who have undergone that pain. That unity is very important to bring about change in society. So I think internationally, Human Rights Now has taken on a major task, and the Physicians for Social Responsibility inside, and we need to have a network, internationally, to start challenging these issues, and that's not what's happening. So they are sitting pretty right now. Nobody's challenging this issue. Nobody has been able to effectively challenge that there's nothing wrong with what's happened.
Well, who would challenge?
No. So what I'm trying to say is, we have to now think long term. We would be the one, we in the sense the community who are here, community in Japan, India, wherever nuclear plants are coming up, they are quite concerned about this. We need to build international links and actually not only work at the domestic level and start challenging the notion that is being put out. And thirdly, very importantly, where the weakest is, they are actually sleeping with each other. The International Council for Radiation Protection is a so-called non-profit private organization. They are setting the standards. Why should they be setting the standards? One. And they are sitting in the International Atomic Energy Agency. Who's funding them? By the way, WHO, who's funding them today? WHO is not being funded primarily by states. It's being funded by private corporate sectors. For example, in health research, that's a major problem. People have alerted, but there's not much money available. So that is going to have an impact. I'm not saying it has a direct impact right now, but it is going to have an impact. So we need to bring this to the notice of the general public. And today it's possible to do it because we have internet. You don't have to have huge amount of money to put information out. And that is become a very important tool in the hands of activists. I think we need to work at an international level and put this on one of the, on the top priorities on the agenda, because it's long term, because you can't see it, nobody notices it, nobody is bothered about it, but it has long term impacts like climate change. This is not taken such a huge kind of priority. Climate change has, for various reasons, but not this, because it is not seen as a problem anymore. We are able to tackle it. And scientists, I'm a biochemist originally. Scientists have this notion we can conquer the earth. Conquer the earth for good purposes. So that's the way that.
How can it be
Thank you.
seen as a problem
If
when
we
we
can
get
move on.
reports like this that there's
We
no
need to move
problem?
on to the next question. please.
Sorry.
Yeah, my name is Carl Grossman. Just some very specific questions. Ms. Inoue from Human Rights Now, in the presentation you said there were potential conflicts of interest of experts involved in the UNSCEAR report. Could you be more specific? And then to the rapporteur, if you wouldn't mind, you just mentioned it was really a delicious comment about private support for WHO. I'm curious as to whether the nuclear industry in any way provides financial support. But Ms. Inoue first, please.
There are reports from media as well as concerns from civil society groups that scientists were involved in drafting and analyzing data at UNSCEAR were involved with the IAEA or ICRP or nuclear industry. We don't know the full extent of the potential conflict of interest, and I think that it's important for citizens to know any potential conflict of interest of all the scientists involved with the full report, because I think that will be important to understand their position of their report.
Okay, I want to make a slightly cautionary thing. First of all, if you look at the WHO funding, you will see, just take the example of Gates. The Bill Gates and Bill and Melinda Gates Foundation, the Gates Foundation, there's a large amount of money. A lot of questions are being raised. It's in the public domain. I'm not saying something which is new. In terms of radiation and nuclear industry, in Japan it was very clear the nuclear industry runs the government program, whether it's the Nuclear Regulatory Authority or something else. But after that, they've tried to clean up the act. But there's a major issue of how they understand potential conflict. When I pose this question that a person from the nuclear industry is going to be sitting on your Nuclear Regulatory Authority, which is supposed to be independent, I said, isn't there a likely potential conflict of interest? To that the answer was no. Now, to understand this is a major problem in some countries, because they think there's no difference between what a corporate sector is doing and what the government is doing, because the program is the same. So this is a major problem, and this is in a large number of countries. What we need to do is to raise this question, and that's the weakest point of the whole the UN agencies, the international agencies like ICRP and corporate sector, because there's nobody talking about this. It's just come to the fore in Fukushima. I think we need to expose the close links between the nuclear industry, governments, and all the other corporates.
Just a follow-up.
One minute. One thing, don't paint a conspiratorial picture of every report, because Marie said something which I thought was an issue. Just to be cautious. When I met the people from the UNSCEAR yesterday, and they kept on repeating, we are scientists, we can't take sides. I don't want to comment on that. And in fact, I remember the first predecessor of your group, the physicians, there were lots of, in England when I was studying, there were a lot of societies like that. So it's been there from, atomic bomb days. But when a group like that goes into Japan, they can't get their own data, they have to rely upon government data. Please remember that. They have to rely upon the US government data. US government had more data than the Japanese government because they have a presence there. So you rely on certain data. But the questions you ask is more important. So for example, there were data about contract workers. Who gave the data to them about contract workers? TEPCO, contractors, or the government. Now whether their data is accurate or not, because if you get a report, XYZ has got exposed to 10 millisievert, hasn't got any cancer, etc., etc. You say no link between Fukushima and that. Have you seen that person? You've not verified the report. If you don't verify the report, you don't know the accuracy of the report. That's why when these workers told me, do you know we are actually living in a shanty town? I can show the photographs. Literally on a pavement, in a non-used pavement between the railway station, there were plastic huts where people were living. In Japan, in Tokyo. This is not Bombay. So it actually astounded me that these things were happening. And then they told me that there are people who come, take them, they give them X amount of money because they have been working as contract workers for God knows how many years. So they are the people available. They have the skills. They are ready to go into the fire and die. Other people are not ready to do it. So what I'm saying is, so when a report like this comes out, you can't just paint it as, oh, it's XYZ. You have to be careful in scrutinizing it. So you need proper scrutiny. And what is happening is it's a good thing that you started to actually start criticizing them. Nobody's been criticizing them. So we need to now develop a fund of knowledge, a lobby of our type of thinking, saying it's people who matter and not corporate agendas, and trying to build that and it is possible because there are a large number of people who think on these issues. But we need to develop people who have knowledge on nuclear science to talk about it. Now in India there are a lot of dissident scientists now.
And just a follow-up question. Do you believe that the 1959 arrangement between WHO and IAEA should be eliminated, and how can that be done?
If you look at the agreement, you see the clause of the agreement, what it says is very interesting. It says you can have an agreement for the peaceful use of atomic energy without prejudice. I just read it now, I haven't seen it before. Without prejudice to the other obligations of the WHO. The WHO doesn't abdicate its responsibility to health of people. Now if that's what's happening, that's a dangerous trend. But according to me, the WHO has said this publicly, and of course I'm a butt of all criticism as the UN Special Rapporteur. The WHO works on the principle, and I'm saying this bona fide, on public health considerations, not human rights considerations. It's a very different paradigm. So even if you have the agreement annulled, there will be cooperation between A and B. That is part of the systems today. You don't have to have an agreement. Agreement only solidifies and formalizes an arrangement. The arrangements are there all the time. Everybody sits together. There are government, corporate, this sitting together all the time. What is the obligation? The obligation is to work within a framework, which is the rights framework, and not a framework which is a purely public health. And this is a major issue. When I was on the HIV reference group in the UN, there's a major debate. What do you mean by human rights framework? Public health is more important. So you're dealing with paradigms. They are different. So you need to get into that debate and argue it out. I'm saying it's much more nuanced than just saying black and white.
I'm sorry that our time is so limited. Did you have a question here?
Yeah, I just wanted to ask.
Here's a microphone.
Yeah, thank you. I just wanted to ask you quickly. I'm sorry, I have to leave. If you can make any comment on the removal of fuel rods process that's coming up, I wanted to ask you that. If I could get your card. About the upcoming removal of fuel rods that's that has a lot of people
A
real
question
nervous.
about the removal of the fuel rods from
That's starting in
Spent
November.
fuel rods.
Yeah, the spent
I
fuel.
believe that environmental organizations are active in raising awareness on that issue. And Human Rights Now does not have expertise on removing fuel rods because it's so scientific. So I believe that it's better to reach out to environmental organizations in Japan such as Greenpeace Japan.
But I mean,
or-
as far as how the government's likely to handle it, or, I mean, is there any outside help? I know that the Japanese recently made a statement where they said they welcomed foreign help and foreign expertise and that kind of thing. You know, because this is such a dangerous process. Is there any raised, you know,
Well, transfer of fuel rods is a very delicate, hazardous, tedious, precise job. Everything has to be set up correctly. A lot of effort has been put into restoring Unit 4, at least the construction floor where the cranes have to be supported. These are precision-controlled cranes. They have to be able to lift many tons. The transfer has to be done under a minimum of 8 feet of water. So the pool where the fuel actually is has to be underwater. As it's raised up and moved horizontally to the container it will be put in, when it's raised up, it still has to be under at least 8 feet of water. So much of this is done at great depth in water. And there has to be a horizontal translation all underwater in some channel from the storage part of the pool to the where the receptacle is sunk underwater. And once the fuel is in there, a lid is put on it, it can be lifted up, drained, the top welded shut, and then that transferred into an actual cask that can be put out on a pad or can be transported to a distant location. It's slow, it's tedious, it's dangerous. The exact condition of the rods in Unit 4 are not known, publicly at least, but there was definitely much damage to that pool. So they will be challenged probably with removing some fragmented or damaged rods. Unfortunately, the rods themselves are manufactured into assemblies of 100, at least 100 rods into one assembly. And the assemblies themselves have to be lifted out in total. So recovery of any fragmented rods, broken rods will be especially difficult and will probably have to be done by some kind of robotic process.
I'm very sorry to have to call this event to a close, but due to the time limit, we must vacate the room. But I would ask you first, I want to thank all of you for coming today, and I would ask you to join me in thanking our three speakers for the presentation today.